What's going on with you?
Nothing much, just eighth quarter. Things are picking up, getting ready for clinic. It's exciting, but kind of scary at the same time because there's like a lot of stuff they want us to know in like a short period of time. So it's a little overwhelming, but I think I'm getting a good grip on it. So
Yeah, it always feels that way. It doesn't change.
yeah, been practicing my adjustments a lot still, keeping up with that. Just been, bugging my classmates, friends, just getting every opportunity possible. Like I think after the seminar, I kind of got like a huge burst of like motivation, and I just like have been just still riding that for like the longest period of time.
Awesome, man. That's really good to hear. That's really cool. You seem like that guy that has that push, that mentality to just gain a bunch of knowledge, anywhere you can get it. Kind of got that vibe from you.
Yeah, no, definitely. I kind of just try to think of myself like a sponge and like absorb whatever I can,
Yeah.
especially in outside of school context as well, and like in terms of practical application stuff,
Yeah.
like adjusting and stuff like that. Just because I feel like at school a lot of the time kind of gets taken up by them trying to teach what the board is going to teach, which a lot of that is like diagnosing PI iliums and like the kind of the bone out of place stuff. And so because they have to teach that for the boards, right, whether they agree with it or not, which a good chunk of the professors don't, but then there are some that do.
Yeah.
And it's like they have to teach it for the boards, and so it's like they don't really have time to always teach the stuff that's actually like useful.
Yeah.
um,
Totally. Yeah,
so
I feel like we all felt very similar. I mean, you're going to feel really ready for the boards. I mean, one of the things that people forget about when you take part four boards is like they test you on confidence.
mm,
So if you're constantly worrying about I to S, M to L, P to A, you know, that's just such a small smidgens of your score. You should be able to look like you know what you're going to do, you know.
right, yeah, and like I can kind of tell when I see people adjust to people who are like overly focused on like those things like line of drive as opposed to just like their execution and their like their force, their body positioning and all that. And it's like I think those sometimes those things just get overemphasized just because that's what the board is going to ask you after that adjustment. You know what I mean?
Yeah. So, how's the personal training business going?
It's going well. It's been doing good lately. I've picked up a couple new clients this year already.
Nice.
Um, Continuing to sort of grow that and just mostly through word of mouth. I was actually talking to an advertisement sort of agency to see if I could work some online ads, but
Yeah.
it's like the time commitment is probably beyond what I have to be able to like facilitate that and to facilitate, I guess, that level of growth at this time. Like I feel like I would get more out of it once I'm out of sort of the busy part of school and then work on the online ads to try to push like 50, 60, 70 clients, because that would also be beyond what I could really handle. But I'd want to, if I'm paying for online ads, paying two, three, $4,000, I want to make sure that it's going to be worth it, and that I'm at a time where I can handle it.
Yeah, for sure. Where are you from again?
I'm from San Jose.
Oh, okay, cool.
Yeah.
And was
So
that the biggest reason why you stuck around and went to Palmer West?
mostly, mostly, yeah, it was just convenience, to be honest. And like my family's from here. Florida's too hot. Um, so yeah. What about you?
I actually ended up picking Palmer West because when I went to, yeah, I'm from Arizona. So when I went
Mm,
out to visit the school, I just kind of looked around and was like, this seems like a really good place for me to be in regards to like environment. I like the smaller class feel in the smaller school, but also I mean, I was impressed with I got to sit in on Cooperstein's lecture, um, and I got to sit in on Souza's lecture. And then when I found out more things about them, I was like, "Well, that's really cool. Like you're learning from the people that are writing the books."
Yeah, no, exactly. Yeah. That's the awesome part. There's so many really big professors at Palmer like that that are just like a textbook of knowledge, like Souza. I don't know if you know Dr. Nook.
No,
Um,
it's a little after my time.
yeah, he's a little after your time, but he falls along the same wavelength. But he's much more into yeah. I think you would like him probably more even because he's like a big motion palpation guy,
Nice.
uh, and he has like a really good philosophy. I think. And yeah, he's really good too. Coop's unfortunately gone now though, as I'm sure you've heard.
Yeah. We had to pay our homage to him at that seminar when we were with you guys. I don't know
Yeah.
where Demir is at. I don't know if he's going to be popping on. He might be stuck watching that game because his bets are riding.
It's all
But either
good.
way, we'll keep it going. How about you give us a little more background about where you're at in school again? So you're in eighth quarter.
Yeah.
Uh, Tell us about some of the clubs, those type of things that you're involved with, and then seminars that you've taken.
So I'm an eighth quarter student at Palmer. We're in like the third or fourth week right now. In terms of clubs that I'm involved with. So I am the president of Rehab to Performance. So we're a club that focuses on sports rehab and active care, and trying to, I guess, fill in the gaps beyond what the rehab courses at Palmer teach, and try to bring in new ideas, advertise various seminars, just help students start learning about rehab earlier on in the program, because I think there's kind of a gap in knowledge often between knowledge of passive care versus knowledge of active care, because there's only so much time in the program, and we only really get 2 real classes to focus on active care. And if you don't come in with like a personal training background the way that I do, for example, you're going to be very behind when it comes to that stuff, and it's going to be difficult for you to be able to give the right exercises to your patients to go along with whatever adjustments and soft tissue work that you're also giving them.
Yeah, progressions and regressions are very powerful things to know.
Mm-hmm.
Definitely. And then any other clubs or seminars that you've taken?
In terms of seminars I've taken quite a few. So I've taken 2 PRI courses. I've taken the Connor Harris biomechanics course. I've taken Factor. I've taken fascial manipulation level 1. I've taken DNS. I'd say those are probably the main ones that are most relevant. And then I'm also a personal trainer, strength and conditioning coach.
Awesome.
Um,
So just to give a little more insight, like for some of the students out there that don't know what we're doing with HVLA, what would you say was your experience going through that course?
So I really liked it. I really liked the amount of contact time that I had with you guys, because there's a really good ratio of students to instructors. And I feel like all the help that I got was very personalized. Like, you didn't just come over and check me for like 30 seconds, be like, that looks good, move on. You'd actually sit there, watch me, and then give me very good personalized feedback in terms of like how I can improve, like the way I create force, like my positioning, all that. And I just thought that was, incredibly helpful to be able to get that level of like one-on-one knowledge and be able to get those reps in with a second set of eyes from people like you that I consider like the top tier in terms of like adjusting abilities. So
what made you want to take the course?
the reason I wanted to take the course is kind of the same reason why I've taken the other courses, why I've gone to MPI seminars, all that, is because I want to be able to get as much feedback as possible on my adjustments and be able to get as many different like opinions and ideas in the mix to see what works for me and what I can do to improve where I'm at now. So then that way, when I get to clinic, all my skills are already going to be there, and all I have to do is focus on more of the like diagnostic stuff. So that way I have all the hard skills down, because for me, I have a lot of the, I guess, the rehab stuff down, but it's like adjusting at the end of the day is what we're being paid for most of the time. And like, that's why people seek us out as chiropractors. So it's like, it's something that I definitely need to prioritize in terms of my skill.
Right on. Hell yeah. So you took the seminar and, you were there for both days. And what would you say, because, we filmed everything for you guys so you can go back and watch. Have you utilized that stuff, or do you tend to go back and see what that looks like?
I mean, honestly, I have not gone and looked at the films. I probably would at some point. I do have pretty good retention of like what I learned, but I think it's definitely very helpful that you guys took those type of films, because a lot of those seminars don't. And I think that anytime a seminar or course that I've taken includes that type of thing, it's always very helpful. Like there's a lot of courses that I've taken that did do it, like Connor Harris. You can still go back and look at all that stuff. That was super helpful. And your guys' course doing that, And it's great because like you can't expect yourself to remember every little detail.
Yeah.
Being able to have that type of knowledge is super helpful. So
Yeah. And so in eighth quarter, you're getting ready to go into clinic.
Mhm.
Where are you in regards to boards?
So I just took part ones. Still waiting on my results.
Stressful.
Yeah.
Wake up at 4:30 and then start clicking refresh until you get your scores. That's how it goes. Yeah, you didn't get to meet Chris, but he's the guy that lives in Reno. We all live together, and I mean, it was like 4:59, and he knocking on the door. Boom, 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 boom. Board scores are going to be up in 60 seconds. Oh gosh, stressful. But either way, you're going to be fine. If you felt like you failed, you did a good job.
Me, like most people, I think thought the spinal anatomy section was a little difficult, but other than that, I felt pretty good about most of it. So
Yeah, school, they do a good job preparing you for boards. They do a very, very good job for that. I'm pretty sure
yeah.
your fail rate's going to be pretty low in regards to like the people that are taking it at the same time as you in the same school. Palmer West is pretty good at that. So I'm pretty sure all Palmers are. All Palmers are. So back to some more like manipulation type stuff. What would you say was something that stood out to you in regards to the seminar outside of like the things that we had already listed before?
I think just the things that stood out were just like the technique that you guys used in like getting me to change my technique in order to match my body was really helpful. I liked a lot of the extremity adjustments too, especially. Those were really, really helpful.
That's my favorite clip from the whole weekend.
Yeah.
Stand on the elbow and you just happen to stand
Yeah.
the perfect shot.
No, I've actually
genuine response. Like
I actually went around at school like for 2 weeks after hitting that adjustment on people, and people were like pretty freaked out by it. A lot of people were scared when they saw it because it looks pretty intense. But it's an awesome adjustment. So I'm super grateful for that, especially, and some of the foot ones too. Like I really like the subtalar one where you put the foot between your legs. I still use that one.
How about this? Let's describe you. I mean, if you could back up the camera and give us a flex so people understand what kind of body we were working with in regards to helping him change, like how you were putting force in. And, classically people will look at you and think you're going to be heavy handed, they're like, very forceful or whatever it might be. What would you say changed for you like during that process ever since then?
I guess like it's like I gotta just learn how to scale up my force to the person that I'm working with. So it's like if I'm dealing with a small person, all I kind of gotta do is like fake drop on them, like kind of fall on them, and they'll go. And it's like if I'm dealing with a reasonably sized person or a bigger person, I need to like really drop into them and drop my chest through my hand the way that you taught me. That was the biggest thing. Is like when you changed my drop from trying to do like a pocket to pocket like leg drop to a chest drop, that just worked so much better for me. It really allowed me to take advantage of my size, I guess, and kind of use my own mass to my advantage. So
yeah, mechanics are fun, aren't they?
Yeah,
you start to like peel the layers back, it starts to make a lot more sense, especially because like what you're about the same height as me, right? We're about 5'8" ish.
Yeah, I'm 5'8".
Yeah, but weight wise, I'm 180, 185 wet, and you're
I actually lost some weight. I'm like 211, but I lost like the bad weight. So yeah, right now. But I was about 220-ish. I was like 220, 225 when I took the seminar. So
and you pull and squat and bench a boatload of weight. So you got plenty of power in reserve for yourself.
Yes. Yeah.
Just boast a little bit. Let's hear what the numbers sound like.
So I have a 611 squat, a 457 bench press, and a 727 deadlift.
It's insane. It's awesome. Love it. Are you planning on practicing in San Jose afterwards?
At this point, I'm thinking probably not. I haven't really figured out where exactly I'm going to practice. I want to look into either maybe joining someone, doing like either a partner practice or temporarily working under someone for like a year, and then eventually trying to open my own thing. I haven't really figured that out quite yet. I just want to sort of network with people and figure out what my options are, and then sort of weigh the pros and cons of each one, and just make sure that if I go work for someone, I can find someone that's willing to pay me. I guess because I have that coaching income already, I kind of have the ability to be a bit more flexible than other people do in terms of like who I'm willing to work for and like what I'm willing to take. But obviously, I want to try to get to work under someone who's going to pay me what. So
Yeah, hell yeah. Well, how about this? Ever since taking the seminar, what questions do you have for me?
I guess like how much of what like did you guys like come up with all those I guess the fancier adjustments on your guys' own? Like how did you like, or were those like things you guys learned from people, or how
So
did that?
kind of like at the beginning, we when we give you guys the slides, we kind of pay the homage to all the people that we've taken seminars from, MPI, McClure, SFMA, FRC, FRA, and the amount of seminars we've taken in conglomeration between all of us is quite a lot. And we've all discussed a lot of stuff throughout time since we were in school and beyond. We literally chat every single day and discuss like our assessment process, how to clean it up more. And in regards to like manipulation, though, like when you're adjusting things, we didn't invent a single thing. We just kind of polished it, I would say. Uh, and we noticed that people would take seminars and they wouldn't necessarily polish up on their skills. And they would expect that one seminar to be the thing that's like, well, now that I learned it, I know it forever. And their practice was very minimal. And then also that was the other thing with other seminars we had taken. It was like you would learn like a T-spine move and it would be maybe like 10, 15 minutes of you practicing it, maybe one or two people, and then boom, you're done and you're moving on to the next thing. And we wanted to make sure we took ample amounts of time, giving you different body types, making sure people are switching around, and then reviewing it in the morning. And especially because sometimes questions pop up the next
No,
day.
yeah, I really like that approach. I think that giving like almost too much content, can be kind of prohibitive too. It's like taking that time to review what we've learned and re-go over stuff. So that way it actually sticks. Because like the thing is, I remember the adjustments that I learned at your guys' seminar, I would say more than I read. So like what I was saying is like I remember the adjustments I learned at your guys' seminar, I think a lot more than I remember at some of the other adjusting seminars I've been to, just because I guess I got more opportunities to practice them. I got more feedback on them. And yeah, I think that really helps with having the review component.
Yeah, so we were thinking about like, okay, what moves do we need to show? And to be honest, it's the ones that we decided to utilize the most were the ones that we tend to see most often in our office, in regards to like the shape of the person that we're working with. So
Mm-hmm.
because you do have to make that kind of decision when someone's laying on your table after you're assessing them and you're like, oh my gosh, this person's hyperkyphotic. And normally I like to do this, but it's not seeming to work. It's like, well, justify why you would do something a little bit different because, we have between all of us, you're going to have 29 years of experience. We're all out of school and we've seen body types and we've tend to come up with the same solutions for that specific body type. So I wouldn't say the moves or anything that we've like invented at all. They're all things that we just brushed up and cleaned up and figured out a really nice place to put it with people in regards to like how you're assessing something. So you'll have more success. For the extremities, there's a lot of people out there that do different things. Like I remember when I went to a guy's office specifically just to learn the first Met head move that I saw him post on YouTube when I was in school. I'd never seen it before. And I was like, what is this? And he's like, this is a really simple move. And for like the next 15 patients, he literally did it on every single one and was like, watch, watch. I was like, sweet, but teach me. So he taught me. And but it was something that was common in Life West curriculum. So it's not like this like magic move that this guy came up with. He learned it in school and then just kind of passed the knowledge to me. I go back to school and I show it to my friends and I'm like, this is sweet. Like this is a wonderful first Met head move. It's on the opposite side that we typically were manipulating in the cuneiforms and everything. So we were just like, where would we use this? And so we just started figuring things out, and it started to create more results for our patients. So that's why we kind of piled all those in there. And then for, like in regards to like spine stuff, when we have the level 1 spine and extremity, but in like our level 2, now we're getting a little more in depth with like, why would you put your hand on someone's spinous process to manipulate that? Like, when is that an appropriate time to do that? What type of body is that really going to fit with? Why would you do more of an anterior to a lumbar region versus like just trying to go straight through extension and rotation? You know, so that's why there's a little bit of the levels to it, because you should master the fundamentals and the basics that you're going to most commonly see. Like, I bust out spinous moves on people every now and then, but for the most part, I can create a lot of success without it.
Yeah, that's something I definitely want to learn because I pretty much don't really do any spinous moves, I want to say, on people at this point in time. So I would definitely be really interested to learn like when do I do spinous contacts and when do I not. Like, for example, with CT moves, I've always found thumb moves to be difficult, I guess, because of like the shape of my thumbs.
Yeah.
But actually, my buddy Nate, who was at the seminar, kind of opened my mind to it, and taught me a way that works a couple times for me. So I'm still kind of trying to work on that one as well.
And then that's what it's all about, is getting with your buddies and figuring
Yeah.
out like how they're using these things, and be like, oh, they're like, oh, well, I kind of stiffened my hand like this instead of like just putting it there. And you're like, wait, I didn't realize I was just doing that. And then you pick up on something and it helps you so much. Yeah,
Yeah.
it's like it's all about the mild little details, which we hammered with you guys, is we want to make sure you're understanding that the mild details is what sets you apart. Because at the end of the day, it's really not super challenging to manipulate a T-spine in the neck and a low back. There's times it is. But if you are precise and you have good finesse, good skill, good hand placement, good touch, you're not grabbing on someone's shirt as you're trying to roll them over. Those little details make a massive difference in patient satisfaction.
Yeah. Yeah. Definitely.
So with students that might be listening right now, why would you tell them to take the seminar? What kind of advice would you give them?
I would say that you should definitely take this seminar because the level and quality of feedback that you're going to get is going to be unmatched. It's just the amount of the feedback that you're going to get is going to be pretty much like second to none. Like, you're going to get so much contact time with these guys. You're going to really become masters of moves you either already know or new moves that you've never done before or new ways of doing a move, and just the way that I improved my adjustments just with these little changes and little details was just really crazy. Like, I was a noticeably better adjuster after the seminar, especially in my side postures. So
Was that the most challenging move for you, side posture, going into that?
I would say it was like hit and miss. Like, I would get it right sometimes and then not on other times, and now it's mostly hit. At this point, I almost never miss a side posture unless it's like a really tough person. I don't want to sound too overconfident, but like, I'm not missing a whole lot the way that I used to. And, occasionally there's like a hard person where something just won't go right, but it's become very consistent, since taking the seminar, especially. So
That's really, really good. Happy to hear that. That's what it's all about. That's why we want you guys to be taking this stuff so you can practice.
yeah.
We want our profession to kick ass, man. Like, we want you to be good with your hands, be confident, not have to worry about that kind of stuff when someone walks into your office. And it's gonna, dude, what's wild is that it's gonna change drastically, because now you're heading into student clinic. Things are gonna get a little more serious. The docs are gonna be a little more on you with like why you're gonna do something. So your justification has to go way up. And then once you get into like the outpatient clinic, now you're working on the public, and you get to experience what those bodies are like. It's nothing like, your classmates. Your classmates are very healthy for the most part. They're getting, set up on quite a bit. They know what to do when they're in the position. And then when you get someone that's never been like an adjustment, had never had an adjustment once in their life, and they're like a 45-year-old construction worker that's having back pain for the first time, or maybe 50th time in their life, and they're like, yeah, I've never been treated before. No massage, no stretching, nothing like that. They eat like shit. And, they move like shit, and then you have to manipulate, and it goes different. That experience is tough, but
Yeah.
we don't want that to be on the back of your mind. We want you to be thinking about other things. Like, you should have the confidence, like you're saying, you don't want to sound too overconfident. It's like, dude, that's the kind of confidence you should have. You want that confidence, but being honest with yourself, it's like, that's
Yeah.
really important.
Yeah, no, like I for sure have still some things to work on and shortcomings with my adjustments, but I would say like my side postures were a weakness, and I'd say are now definitely my strong point. So
Cool.
yeah.
Love it. What other things would you tell students? Anything else that you would say about the seminar, your experience?
I just think that I guess just the ways that you guys did things was just like a little bit differently, and it was just like a nice, unique flavor on, like, let's say like anteriors, for example. Like you guys had a lot of little subtle tips there, like turning the head to the side, some of the TL junction moves, really good. Like the one where you push the hands down and they're laying prone, that was good. I feel like especially the second day, I picked up a lot of like kind of new moves that are just really great, helpful, and I think that any student would benefit from going to the seminar.
And then for yourself, what do you have planned? What's your next seminar? What are you going to take?
So because I'm taking kind of a lot of like rehabby seminars at this point in time, I think I'm going to just focus on just applying that already existing rehab knowledge, because I already use a lot of that rehab knowledge on my clients. So I'm probably going to be focusing more on adjusting seminars. So if there's a level 2 coming by, I'm for sure going to take it with this, and just think I might go down deeper with FM as well, fascial manipulation, because that's what I like for soft tissue.
Yeah.
So I think down the line, I'm probably going to look at taking level 2, 3, and 4, and then maybe eventually even doing the FM school.
Awesome. We love to hear it. Well, thanks for doing this. So we really appreciate it.
Yeah, no problem.
Demir tried getting there, and
Yeah.
it seemed to really work too well for him. Either way, I really do appreciate you taking the time to talk to us, and maybe get some more encouragement out there for some of the people that don't know us. Because we are new to the whole world for this, but our goal is to get in front of a lot of faces, and just help give back and make the profession that much stronger.
Yeah, like I think very highly of you guys. You guys are a really good group. You guys have really good advice, not just for adjusting advice, but also like career advice, and like good, I guess, just real experience on like what it's like when you get out. And I think just the more people you have to talk to on that front, the better. So I think it was definitely worth it. And I'd recommend like anyone who wants to get better at adjusting should go ahead and take it.
Appreciate it. Yeah, we might be coming back out to San Jose. We're trying to figure things out. I just announced that I'm having my second baby, so some things might shift around. Yeah, thank you. Yeah, having a boy. Pretty excited. So we're gonna kind of get some things set for potentially the summer. We'll be able to get back out there, but we'll keep in touch. We'll let you know.
Okay.
Yeah,
Sounds good.
I'm gonna chat with Kendra and all them again. See what all you guys are wanting.
Yeah. Oh, I'd definitely go. So
awesome, brother.